Today, this will be your first recorded lecture on the responses to altered endocrine function. On this unit, we will be discussing about endocrine system and then the specific disorders under which. So, let's talk about the endocrine system. One important function of your endocrine system is the production of your hormones. When I talk about hormones, these are chemical transmitter substances that regulate and integrate body functions. So we have several hormones. For example, you have your growth hormone, you have your oxytocin, you also have your ACTH. Your endocrine system plays a vital role in congruence to your nervous system and your immune system in such a way that the products produced by your nervous system, specifically your neurotransmitters, could also act as a hormone that could act on a specific organ of our body. On the other hand, your immune system also produces hormones, and the hormones produced by other organs may also impact the immune system in such a way that it can depress or stimulate the immune system. Particularly, we're talking about the functions of your adrenal gland when it comes to immune system modulation. And then we also have your thymus. Now, here are the organs of your endocrine system. For us to clarify further, let us first differentiate between endocrine and exocrine glands. When we say endocrine glands, these glands secrete the hormones to the bloodstream. On the other hand, your exocrine gland would secrete the hormones that they produce to the epithelial surface or the GI tract. So if I am talking about the surfaces of your stomach, and then we're referring to the pepsin, okay, and to the parietal cells, which produces the acid in the stomach, it's referred to as an exocrine gland. Okay, when I talk about endocrine gland, okay, a very good example would be your pancreas. Your pancreas produces your insulin. The insulin produced by the pancreas is part of the endocrine function of your pancreas. Recall our previous discussion in gastrointestinal system. Your pancreas also produces your amylase and lipase. The amylase and lipase produced by your pancreas is part of the exocrine function of your pancreas. The other organs of your endocrine system are labeled on the image. You have your hypothalamus. So try to find out what are the hormones produced by your hypothalamus and what is the relationship between the hypothalamus and then the pituitary gland. Who produces the hormone? Will it be the hypothalamus or the pituitary gland? And for the pituitary gland, there are two divisions. You have your anterior pituitary gland and then your posterior pituitary gland, which are referred to as your adenohypophysis and your neurohypophysis, respectively. Then you have your thyroid gland. We also have your parathyroid, and then your thymus, which I mentioned to be part of your immune system and your immune response. Then you have your adrenal gland, which is in charge of your steroid production. And then we have the islet of Langerhans of your pancreas, which is in charge of the endocrine function of your pancreas. The other cells or other parts of your pancreas, again, would be in charge of the exocrine function. Other than this, we also have your gonads, okay, your testes in males, and then your ovaries in females. So all of those organs mentioned have produced or can produce a hormone that could impact on the specific organ site on the body. The image on the slide illustrates your pituitary gland. So your pituitary gland, as previously mentioned, is divided into two, your anterior pituitary and your posterior pituitary gland. Your posterior pituitary gland is referred to as your neurohypophysis. So take note, another term for your pituitary gland is your hypophysis, in such a way that if you will hear hypophysectomy, that would mean removal of your pituitary gland. Now, going back to the anterior and posterior pituitary gland. The anterior and posterior pituitary gland secretes different kind of hormones. Okay, for you to remember, just try to memorize that in the posterior pituitary gland, there are only two hormones or primary hormones secreted. And that is your oxytocin, which acts on your breast and your uterine wall. And then you also have your vasopressin. Your vasopressin is another name for your antidiuretic hormone. Recall that the function of your antidiuretic hormone is, okay, recall, antidiuretic. So meaning it tries to stop your urination by doing water retention. So again, the two hormones produced in your posterior pituitary gland is your oxytocin and then your vasopressin or your antidiuretic hormone. Hormones produced in your anterior pituitary gland would include the following. First is your TSH. TSH is thyroid stimulating hormone, meaning it stimulates your thyroid gland. So that will be In return, it will lead to the production of your T3 and T4, which are the potent hormones produced by your thyroid gland. And then we have your ACTH. Your ACTH stands for adrenocorticotropic hormone. Adreno, that refers to your adrenal gland. And then we have your FSH and your LH. Recall your lessons in MCN. These are your follicle stimulating hormones and then your luteinizing hormones, which are all in charge in your menstrual cycle and also on stimulating your gonads, which are your testes and ovaries, respectively. Then on return, your testes would produce testosterone and then the ovaries would produce estrogen and progesterone. Also, from the anterior pituitary gland is your prolactin, which also acts on the breast. Okay? You might notice that there are two hormones that directly act on the breast. One is your oxytocin and then the other one is your prolactin. Notice or remember, the difference on their function. Your prolactin is the one which is in charge on milk production. On the other hand, your oxytocin is the one in charge on milk letdown. Okay? Remember that difference between the function of your prolactin and oxytocin. Just remember prolactin, lactose related to your milk. And then you have your growth hormone. So your growth hormone is more on your bones, muscles, and organs. In such a way that excess of your growth hormone would lead to the condition referred to as gigantism, whereas the deficit of your growth hormone would lead to the condition dwarfism. Okay, so again, try to familiarize that the two hormones produced in your posterior pituitary gland are your oxytocin and your vasopressin. And then again, try to answer my question. What is the relationship between the hormones produced by your hypothalamus and then that of the pituitary gland? Function and regulation of hormones. Each of the hormones in our body would have a specific function. It would act on a specific organ. Its effect on the organs may either be to stimulate or regress the function of the organ. However, we will be discussing that specifically while we are touching on the disorders. It's wise for us to know that the rapid action of the nervous system is balanced by the slower hormonal action. Recall your lessons on neurotransmitters. Your neurotransmitters tend to act fast, tend to act rapidly, and this is balanced by the slower hormonal action. And then we have the term here, negative feedback mechanism. What do we mean by negative feedback mechanism? Whenever a certain substance in the body would decrease, let's say for example, calcium, a certain hormone would be released. An example would be your parathyroid hormone. Okay, your parathyroid hormone was released in response to the decrease of calcium. By the time comes that there will be an increased levels already of calcium, another hormone will be released in the form of your calcitonin. And the purpose of calcitonin is to balance the function of your parathyroid hormone. In other words, your negative feedback mechanism is at work. Okay, the purpose of which is to balance out the effect of another hormone. This effect goes hand in hand, okay, among all other hormones that we have in our body. Whenever a certain hormone would increase a certain substance, another hormone will be able to combat the effect of that hormone. Okay, later on you'll be knowing about insulin, glucagon, somatostatin. Okay, we'll also be knowing about T3, T4, and then calcitonin. Okay, so remember your negative feedback mechanism. So again, when I say negative feedback mechanism, it is intended to maintain equilibrium of the hormones and the chemicals in our body. Now, let's talk about your disturbances in glucose metabolism. Perhaps the disease that you're most familiar of is your diabetes. So you know that your diabetes is the increase of your blood sugar in the blood. So disturbances in glucose metabolism. Now, your pancreatic endocrine function might have the following diseases. One is your hyperglycemia, and then the other one is your hypoglycemia. So your hyperglycemia is referred to as your diabetes mellitus, and then your hypoglycemia is also a problem related to your pancreas. Let's talk about the endocrine functions of your pancreas. So your endocrine functions of the pancreas is taken care of by your islets of Langerhans. Okay, that's the specific part of your pancreas that would produce your glucagon, insulin, and your somatostatin. So in your islets of Langerhans, you have the following cells. You have your alpha cells, which produces your glucagon. You have your beta cells, which produces your insulin. And then you have your delta cells, which produces your somatostatin. Okay, so again, try to remember alpha would produce glucagon, beta would produce insulin, and then delta would produce your somatostatin. So this image illustrates your islets of Langerhans. So containing your beta cells for that matter. So let's talk about insulin. Specifically, your insulin is produced by the beta cells of your islets of Langerhans. Your insulin is released to the bloodstream in two rates. One is your basal rate, and then the other one is your bolus rate. So when I say basal rate, okay, this is released in small amounts. However, the release is continuous. Hence, it's referred to as basal. Okay, it's the base value of your insulin in the body. When I say bolus rate, your bolus rate is released in larger amounts, and these larger amounts is usually in response to a stimuli. Okay, so for example, if you've eaten a lot of meals, okay, there will be a bolus of insulin that will be released in the bloodstream. Okay, that's what we refer to as your bolus rates of insulin. Now, what happens? If we eat, the tendency is for the insulin to increase. Your pancreas would produce increased insulin in such a way that the glucose would move from the blood going towards the muscle, liver, and the fat cells. That is the way for our body to utilize the glucose in our blood. In other words, with the lack of insulin, the glucose in our bloodstream will not be utilized. Okay, which is the problem in your diabetes mellitus. Okay, take note, there is a decrease of insulin in diabetes mellitus. That's why you are having a lot of sugar. Hence, the sugar that you're taking is not being utilized by the body, could not be utilized by the muscle, liver, and the fat cell conversion. So hence, it leads to increase of glucose in the bloodstream. Now, what are the functions of insulin? One, it transports and metabolizes carbohydrates for energy. So it transports and metabolizes your sugar for energy. What do you mean by that? Without your insulin, your sugar, your carbohydrates cannot be used for energy. Second, it stimulates storage of carbohydrates in the liver and muscle in the form of your glycogen. So once your insulin is already functioning, it would trigger your liver and muscle to store glucose as glycogen. Later on, this glycogen could be broken down to simple pieces, okay, to have your glucose in a process that you refer to as glycogenolysis. So your glycogenolysis is the breakdown of your glycogen to become simple sugars, which is your glucose. Then, your insulin would also signal the liver to stop the release of glucose. Your insulin is telling your liver that there's enough glucose right now in the bloodstream, hence the glucose in the liver needs to be conserved. Furthermore, it also enhances storage of dietary fat as adipose. So your adipose is being stored by your insulin. Next, it also accelerates the transport of your amino acids into the cell. So your amino acids, remember, is byproduct of your protein. Your amino acid is important for the formation of our vital proteins in the body, specifically your essential proteins. Then, it also inhibits the breakdown of stored carbohydrates, proteins, and fats. This is an important function of insulin. Again, it inhibits the breakdown of stored carbohydrate, protein, and fats. Meaning, without insulin, your body would try to break down protein and fats to be the source of energy. It is the insulin in our body that stops the breakdown of protein and fats to be utilized as energy. Why would it be bad to use protein and fats as energy? Yes, especially your fats. Your fats, if utilized by the body as the source of energy, would lead to the production of your ketone bodies. Later on, we'll be knowing about diabetic ketoacidosis, which is a severe form of your diabetes, a life-threatening complication of your diabetes. Let's have your glucagon. So glucagon is another hormone in your produced by your pancreas. Your glucagon is released in response to a low blood sugar levels. Okay? If you would notice earlier, insulin is being released if there is an increase in blood sugar levels. Right now, we're talking about glucagon. Glucagon is released in response to low blood sugar levels. Okay, so this is negative feedback mechanism on the work. It stimulates the liver to release the stored glucose in two ways.
One is glycogenolysis, and then the other one is gluconeogenesis. Okay, let's try to differentiate. Glycogenolysis. Lysis stand for breakdown. Breakdown of glycogen to produce glucose. So when I say glycogenolysis, it is the process wherein the liver produces glucose through the breakdown of glycogen. And then 8 to 12 hours without food, your gluconeogenesis would commence. In your gluconeogenesis, the liver forms glucose from the breakdown of non-carbohydrate substances, including your amino acids. Okay, so gluconeogenesis, genesis, it's the makeup. Okay, it's the formation of your glucose. In this case, it comes from or it came from your amino acids. So again, glucagon, its function is that it tries to increase your blood sugar levels through the process of glycogenolysis and then your gluconeogenesis. The third hormone, you have your somatostatin. Your somatostatin would inhibit the release of both your insulin and glucagon. The action of your somatostatin would be to delay the nutrient absorption by the GI tract to prolong the duration of intestinal absorption after a meal. Okay, so your somatostatin tries to balance out the quick action of your insulin and your glucagon. Okay, again, to delay the nutrient absorption of your GI tract. So there we have the three hormones produced by your pancreas. You have your insulin, you have your glucagon, and then you have your somatostatin. Okay, so try to answer these questions. What is deficient or lacking? What is deficient, or lacking in a patient with diabetes mellitus? What is a problem if my patient is having hypoglycemia? What hormone could be in excess and what hormone could be in deficit? What is the problem if my patient is having hyperglycemia? What hormone could be in excess and what hormone could be in deficit? Okay, just try to practice on those questions. Diagnostic studies. Since we're talking about your diabetes mellitus, there are several diagnostic studies for us to diagnose or confirm the presence of your diabetes. One is your FBS. FBS is fasting blood sugar. Since it's fasting, okay, you need to remember that you need to educate your patient that they need to be on NPO for 8 hours. Common question would be, I will be on NPO, can I take candy? Of course, that will be a big no because your candy would contain sugar. If your patient will be asking, can they take water? If your patient is having NPO simply for the purpose of fasting laboratories, your textbook would say that they can take water. Okay, your water is not part of the NPO for fasting laboratories. But if your patient is placed on NPO because of surgery, that's the time that you need to place your patient on NPO, including your fluids. Because again, you recall that in surgery, we're talking about the risk for aspiration. So again, if we're talking about FBS, textbook would say that your patient can take water. However, clinical practice refer to hospital protocol. Okay, there are three common fasting laboratories in the hospital setting. That would be your FBS, lipid profile, and uric acid. Okay, once you see any of these three, you need to prompt your patient to be on fasting. FBS, your patient needs to be on fasting 8 hours. Common instruction in the hospital setting is that, ma'am, you are not allowed to take any food by mouth from 10 p.m. because we expect the laboratories to be taken at around 6 p.m. 6 a.m. To 8 a.m. Okay? How about if your patient would ask if they can fast for, let's say, more than 24 hours? That would be a big no-no because that will be a false negative on their result. Okay, over fasting will also not be beneficial to your patient. Other than they are fooling the laboratory result, they might be exposing themselves at risk for your complications of diabetes if ever they have diabetes. Next, your RBS. Your RBS is your random blood sugar. As the term implies, random blood sugar. Hence, your patient does not need to be on fasting. Okay? Your random blood sugar is done in the laboratory setting. If done on the bedside setting, the common test that we have is your CBG. Now you're familiar of your capillary blood glucose. Your capillary blood glucose is also a form of your random blood sugar testing. So normal values of which would play between 80 to 120 milligram per deciliter. Then you have your OGTT. OGTT is oral glucose tolerance test. There is also an IV GTT, your IV intravenous glucose tolerance test. Okay, at present, these tests are not anymore recommended. However, for the purpose of knowing, okay, among these patients, for example, who will undergo OGTT, a certain amount of sugar will be administered to the patient, and after some time, the patient's blood sugar levels will be monitored. Let's say after 30 minutes, 1 hour, after 2 hours, for us to check if the insulin of your patient is working. If your patient has enough insulin, regardless of the tablespoon of sugar that you have administered to them, they will be able to balance their blood sugar levels within a certain period of time. Okay? Then you have your HbA1c. Your HbA1c is your glycosylated hemoglobin. Okay, it refers to your glycosylated hemoglobin. Common question would be, do I need fasting if I will undergo HbA1c? No. Okay, your HbA1c would be able to detect your compliance to your medications for the past 2 to 3 months. And fasting for 2 to 3 months is a no-no. You know, it can't be done. So, for your HbA1c, again, it is able to monitor your blood sugar control for the past 2 to 3 months. Hence, it is commonly used to evaluate effectiveness of your OHA. OHA stands for your oral hypoglycemic agents, and also your insulin dosing. Okay, if your patient is having high levels of HbA1c, okay, they need to change their treatment, or they need to have strong adherence to the prescribed lifestyle to them. Because remember, the management on diabetes is not all about your OHA and your insulin. Okay, management on diabetes would be on dietary and lifestyle changes. Then we also check the urine for glucose. Okay, why would that be? Remember in our discussion in renal that your kidney has a renal threshold. So your kidney has a renal threshold of 160 to 180 milligram per deciliter. Okay, other textbook would say 200 milligram per deciliter. What do I mean by renal threshold? If the blood sugar levels would be beyond this renal threshold, the glucose would come out of the patient's urine. In other words, if there is presence of glucose in the patient's urine, that would mean that the blood sugar levels are already very high in such a way that the glucose are already leaking out through the glomerulus. Then you have your test for urine, ketones. Okay? The presence of your ketones in the urine would signify the fat metabolism. Okay? So, presence of ketones in the urine is referred to as ketonuria. Okay, ketonuria. And then the presence of glucose in the urine is glucosuria. Going back to your ketonuria, so your urine ketones would be present if your patient is already using fat as a source of energy. In other words, there's no more glucose or there's no more insulin that could metabolize the glucose intake of your patient. Hence, the body is opting towards your fat metabolism to be the energy source. With that, ketones will be present in the urine. The presence of the ketones in the urine would signal your diabetic ketoacidosis. Then you have your ultrasound and then your CT scan. Ultrasound and CT scan are imaging studies that could be used to determine if there are presence of abnormal masses in the pancreas that could possibly lead to imbalance on the hormone production from the pancreas. Furthermore, your ultrasound and CT scan could also detect for the sequelae of your diabetes, such as your diabetic gastropathy, which is impairment on gastric functioning related to prolonged increase of your blood sugar levels. I would like also to add that your ultrasound and your CT scan could also be used to evaluate for structural changes on other organs such as your thyroid. Okay, so we have your endoscopic ultrasound of the thyroid, which can detect for the presence of carcinoma. Your carcinoma of the thyroid could possibly manifest as hyperthyroidism. It could also possibly detect abnormal growth in the ovary, which could cause abnormalities on the production of estrogen and progesterone. Also, the same on the adrenal glands. It can also detect presence of adrenal tumors, which can cause a rapid increase or rapid release of catecholamines, which would result to a blood pressure increase, which could not be relieved by common antihypertensives. So these are the probable uses of these imaging studies. If the patient will be undergoing surgery, specifically a thoracovascular surgery. When I say thoracovascular surgery, that usually involves the neck and then the chest. Okay, the doctor might opt for MRI for the doctor to have a specific imaging on the borders of the cancer and then the organs and the blood vessels that will be affected during the surgery. On the next recorded topic, we'll be talking about diabetes mellitus and its specifics. Thank you very much for your attention on this one.